Okay, time for another letter assessment. As before, only one person has commented on Instagram and the channel and shared, which is kind of a pity, because we had about 6 letters posted in the group, but that's just how it is. That's our rules for assessment now, and I don't think that's particularly harsh. It's not costing you a penny. All you have to do is to comment and share, and that's it. So if you can't even do that for us, then why do you think I'm going to do free assessments for you? I'm just not. So, disclaimer as always. Okay, we've got the case notes here, and we've got the criteria here to refer to. That's for the IELTS test. Just close that. We don't need that yet. Well, we don't need that here at all. So, as I said before, you go to the task first. That'll tell you audience and purpose. So, referral letter to the surgeon for the consultation. Okay. Consultation, possible knee joint replacement. So, for physiotherapy, increase analgesia dose, refer to the surgeon. That's me, the reader. Okay, so we've got the history here. Some of it we will need, some of it we won't need. So, presenting complaint, pain in the knee. Okay, pain can go to rest, treatment record. Okay, so there's quite a few things to include there. That's not so bad. So, let's have a look. I've got it here. Where is it? Here we go. Let's make sure we've got some changes. Edit changes, okay. Mrs. Potter, whose signs and symptoms right now, there's a little go here. We need a verb, are suggestive of worsening osteoarthritis of, now is it the knee? Of worsening osteoarthritis of the knee for further assessment and consideration of a joint replacement. Okay, that's good. Purpose is clear. Now, some grammar. Why is it present perfect? Passive. We know when it occurred, so we need the simple past. Yeah, we only use present perfect when we don't know the date or when it was the action, etc. But here we know in 2008 and 2015. So, who was diagnosed in 2008 and 2015, respectively. Now, I would have been tempted not to put that for your visit. So, you've got a visit. Let me just check. Was it just for one visit today? Let me have a look. So 24th, test results, 23rd, so presumably, yeah, okay. Presenting complaint, 23rd, and test results the next day. Okay. Seems to be clear enough there. So, I would have still put the date, though, on the 23rd, blah, 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 blah. Mrs. Potter presented to me, blah, blah, blah. And I would have put this in a history paragraph or a little bit later or further below in the letter. And in fact, probably history paragraph would have worked quite well if it was here. Regarding a medical history, Miss Potter was diagnosed, blah, 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 blah. Okay, so a separate paragraph for the history, I think there would have worked quite well. If we take a look at the notes again, because it's not really urgent. It's not like urgent, she's got to come in immediately. Because if it was, then you would put the urgent part as paragraph 2, but we don't really need that. So we don't need this, but osteoarthritis 2008, okay, medications, okay. So yeah, I would have been tempted to put the history paragraph 2. And that informs, what comes afterwards. Okay, so yeah, I say I would have put history paragraph there. And then, just grab this and quickly put this there, blah 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 blah, and she's been taking and put this, put these meds there. So on the 23rd, Mrs. Potter presented. We know it's to you. Who else would it be to? Presented. Now, with increased amount of pain in the left knee for the last 12 months, how can she present with that? That's not a complaint, so she would have to come in and say, presented with a 12-month history of pain or something such as that, because she can't present with an increased amount of pain in the left knee for the last 12 months. That doesn't really work. So let's see what it says here. So, pain in the knee for the last 12 months, now quite severe. Okay, so she's had this pain for a year, but now it's quite bad. And her Panadol is not working. So, that's not quite what you say there. Presented to me with a 12-month history of pain in the left knee, which has recently increased in severity. Now, that makes more sense, yeah? If we do it like that, that makes more sense if we do it like that. So, move that, put that there. The 23rd, Mrs. Potter, presented with 12 history pain in the left knee, which has recently increased in severity, which is more or less what that says, right? So she's had this pain for a year, but now it's got really bad and it's not being relieved by her usual meds. So that makes perfect sense now. Okay. The pain was not really very regular meds, and now can occur, or even occurs at rest after a long walk. Okay, so that's good now. It's logical. Examination revealed, the examination revealed, reduced the movements of the left knee, pain on the joint line, prescribed, as well as some blood tests. Today on presentation, well, we don't really need this. On presentation of what? Today, Mrs. Potter's X-ray shows severe osteoarthritic changes in the left knee joint, osteophytes and loss of joint space. With no evidence, loss of joint space, with no evidence of fractures. Now, I will move this down, make it a separate section. Now, in view, we usually say in view of the above, in view of the above. Now, I would appreciate, now she might need a physiotherapist and increased doses of analgesia. That's your treatment plan. Okay, but you're referring to the surgical consultant asking about possible knee joint replacement. So this is the treatment, so that's slightly separate. If you would be above, right, I would move that, right. So if you would be above, I would appreciate if you could assess her and see which is a candidate for knee joint replacement. But you can put something like, please note, just to inform them of the plan. Please note. Now, is it a definite arrangement? Yeah. Please note. I will arrange for a physiotherapist. Okay. and have increased her dosage of analgesia. Okay, so we can include that. So it's all about this logical sequencing of information. Okay, so as I said, right, so the purpose is good. I will put the history there. Okay, so she's had this in 2000. Okay, hypertension, I don't know if we really need that, but certainly the osteoarthritis was part, yeah. So I put that there. Okay, so you want me to assess her, see if she needs a joint replacement. She had osteoarthritis 2008. She came on the 23rd, yesterday. She's got a 12-month history of pain, but it's recently increased in severity. Okay. Not relieved by her meds. Examination showed blah, 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 blah. Today, the results showed, etc., etc., etc. So, in view of this, I would appreciate it if you could assess her, and then, please note, because I don't really need it, but it's, secondary, I will arrange for physiotherapist and have increased her dosage of analgesia. Okay, so if you do it like that, that makes perfect sense. Everything's logical, well laid out, etc. Okay, I'll just put that, get it all on the screen so you can see. Okay, so that's how I would do that particular letter. Okay, hope that helps, and I'll publish a new task a bit later today. Okay.